Good day. Today, I would like to discuss a topic that, while sensitive, is a crucial aspect of reproductive health that deserves our understanding and compassion: spontaneous miscarriage and abortion. These are subjects that touch the lives of many individuals and families, and it's important for us to approach this discussion with empathy and open-mindedness. As we delve into this topic, let us remember to approach it with respect for diverse perspectives and experiences. It's a complex and nuanced subject, and our aim is to foster an environment of understanding and support as we explore the medical, emotional, and ethical dimension associated with spontaneous miscarriage and abortion. First, I will discuss what is the difference of spontaneous miscarriage and abortion. So, the miscarriage is a naturally occurring event, unlike the medical or surgical abortions. It is the ending of the pregnancy through medication or surgical. So, the spontaneous miscarriage has 5 classifications, such as the threatened miscarriage, the inevitable miscarriage, the incomplete miscarriage, the complete miscarriage, and also the miscarriage. So, I'll be showing a video about spontaneous miscarriage and its classification.
Today's topic is miscarriages. Miscarriage is the natural death of a fetus before it is viable, usually in the first 20 weeks of pregnancy. Medically termed spontaneous abortion, miscarriage is one of the most common pregnancy-related issues. The American College of Obstetricians and Gynecologists, or ACOG, estimates that about 15% to 20% of clinically recognized pregnancies end up in miscarriages. Although it is common, it can be an extremely traumatic and devastating experience. Many women may even have a miscarriage before they know they are pregnant, or before it has been confirmed by a healthcare provider. In women who are under the age of 35, the risk is about 10%, while in those over the age of 40, the risk is about 45%. Most women who have a miscarriage go on to have healthy pregnancies after a miscarriage. After one miscarriage, the predicted risk of miscarriage in a future pregnancy is usually about 14%. The predicted risk increases to about 26% after 2 miscarriages, and after 3 miscarriages, it increases to about 28%. Types: threatened miscarriage. The woman may experience signs of miscarriage, such as bleeding with lower backache, but the loss of pregnancy has not yet occurred. Incomplete miscarriage, where some of the tissue from the pregnancy has been expelled from the uterus, but some remain. Complete miscarriage, where all of the tissue from the pregnancy are expelled from the body. Missed miscarriage, where the embryo dies, but the body does not expel the pregnancy tissue, and no symptoms such as bleeding or pain are experienced.
The first classification of the spontaneous miscarriage is the threatened miscarriage. It is a condition that indicates the potential for miscarriage or early pregnancy loss. So, the threatened miscarriage describes vaginal bleeding and pelvic pain in the first trimester of the pregnancy. So, the treatment usually involves watchful waiting. In most cases, the pregnancy continues and doesn't end in miscarriage. So, the threatened miscarriage occurs in the first half of the pregnancy, but most commonly in the first trimester of the pregnancy. So, here are the signs and symptoms of the threatened miscarriage. It includes the vaginal bleeding, abdominal cramps, fetal cardiac activity, cervical os is closed, and the products of conception are not expelled. So, the vaginal bleeding is mild and may include passing small clots or tissue-like materials. So, the pain of the abdominal cramps is typically dull, not sharp or intense. However, it can progress to constant severe pain. So, the fetal cardiac activity is present in the ultrasound. The cervical os is still closed As we can see in the picture, the products of conception are not expelled. So the second classification of the spontaneous miscarriage is the inevitable miscarriage. It refers to the unexplained vaginal bleeding and abdominal pain during early pregnancy. So the inevitable miscarriage is where women have unexplained vaginal bleeding and abdominal pain early in their pregnancies. Inevitable miscarriage occurs when vaginal bleeding occurs before 20 weeks gestation in the presence of the cervical dilatation. So there are signs and symptoms of the inevitable miscarriage such as vaginal bleeding, abdominal cramps, fetal cardiac activity, the cervical os is dilated, the products of conception are not expelled. So the bleeding is heavier than the threatened miscarriage, the abdominal cramps are more severe, the fetal cardiac activity is present unlike the threatened miscarriage. An inevitable miscarriage is also accompanied by dilatation of the cervical canal. The open cervix is a sign that the body is in the process of miscarrying the pregnancy, and the products of the conceptions are not expelled. So next is the incomplete miscarriage. It is a case where part of the fetus and placenta are still in the uterus and not yet expelled. So there are signs and symptoms. It includes vaginal bleeding, abdominal pain, cervical os is dilated, the products of conception are partially expelled. It usually presents with moderate to severe vaginal bleeding. The cramping may be like rhythmic or labor-like, although less intense than a full-term labor. As we can see in the picture, the cervical os is dilated and the products of conception are partially expelled. So next is the complete miscarriage. It refers to a miscarriage in which all of the pregnancy tissue is expelled from the uterus. So this is common for miscarriages that happen before 12 weeks. So there are signs and symptoms. First is the vaginal bleeding, the abdominal pain, the cervical os is closed, the products of conception are completely expelled. So with the complete abortion, all of the uterine contents of the pregnancy are expelled, after which cramping and bleeding subside, the cervix return to an undilated state, and the uterus begins to invulate. Other symptoms of pregnancy disappear, and a pregnancy test will yield a negative result. So only emotional support is generally required. So next is the miscarriage, a pregnancy loss in which the embryo has died but your body hasn't expelled it yet. It is also called a silent miscarriage. So a miscarriage typically occurs during the first trimester. It is often diagnosed when there is no fetal activity during a routine prenatal ultrasound. So there are signs and symptoms. So the vaginal bleeding and the abdominal pain is often absent. The fetal cardiac activity is absent. The cervical os is closed. The products of conception are not expelled. So a miscarriage happens when the fetus stops developing within the uterus without apparent signs such as bleeding, the lower abdominal cramping, or back pain. It is also known as a silent miscarriage or the silent abortion. I will now discuss the complication of the spontaneous miscarriage, such as hemorrhage, infection, isoimmunization, and powerlessness or anxiety. First is hemorrhage. If excessive bleeding is occurring, immediately position a woman flat and massage the uterine fundus to aid contraction. Next is the infection. The E. coli is the organism responsible after miscarriage, which is spread from the rectum forward to the vagina. Next is the isoimmunization. In the case of Rh negative mother and the Rh positive fetus, whenever a placenta is dislodged either by spontaneous birth or DNC, some blood from the placenta villi may enter the maternal circulation, causing isoimmunization. So the isoimmunization is the production of antibodies against Rh positive blood by the mother's immunologic system. So if her next infant is to have Rh positive blood, these antibodies would attempt to destroy the red blood cells of the next infant. Therefore, all women should receive D-antigen immune globulin to prevent the buildup of the antibodies. So next is the powerlessness or anxiety. So it is very important to assess the woman's adjustment to a spontaneous miscarriage. I will be showing a video about abortion.
Today we're going to be discussing a topic that is often controversial, but nonetheless important to talk about: abortion. Whether you're pro-life or pro-choice, it's important to have a basic understanding of what abortion is, how it's performed, and what you should know if you're considering this option. Simply put, abortion is a medical procedure used to end a pregnancy. It can be performed either through medication or surgery, depending on how far along the pregnancy is and other factors. The embryo or fetus, along with the placenta, is removed from the uterus by a licensed healthcare professional. The decision to end a pregnancy is a deeply personal one, and ultimately, it's up to the individual carrying the pregnancy to decide what's best for them. However, there are some restrictions on who can get an abortion depending on the country or state. In many places, there are laws that limit when an abortion can be performed, such as after a certain number of weeks or only in certain circumstances, such as if the pregnancy is a result of rape or incest. If you're considering having an abortion, it's important to seek counseling from a healthcare provider before making a decision. They can provide you with information on the different types of abortions available, the risks and benefits of each procedure, and what you can expect during and after the procedure. They can also provide emotional support and help you make a decision that's right for you. So, that's a basic overview of what you need to know about abortion. Remember, it's a deeply personal decision, and it's important to have accurate information and support when making this choice. If you have any questions or concerns, we encourage you to talk to a healthcare provider or a trusted friend or family member. Thanks for watching.
So there are two types of abortion: the medical or medication abortion and the surgical abortion. I will first discuss the medical or medication abortion. So it uses medicines to end the pregnancy. It is sometimes called a medical abortion or abortion with pills. Example of this is the mifepristone, also called the abortion pill. This stops the hormone progesterone from working, so the lining of the uterus breaks down, so the pregnancy cannot continue. In many cases, the first day of your last menstrual period must be less than 9 weeks ago. So there are complications of the medication abortion, such as heavy bleeding, cramping, nausea, and diarrhea. So next is the surgical abortion. It is a procedure to remove the pregnancy from the uterus. So the surgical abortion involves dilating the opening to the uterus. Suction is used to remove the fetus and related pregnancy material from the uterus. So there are a series of tests need to be done before the procedure. First is the pelvic exam to confirm the pregnancy and estimate how many weeks pregnant you are, and then the urine to check if you are pregnant, and the blood test to check your blood type. Also, the ultrasound test to check how many weeks pregnant you are and the location of the fetus in the womb. So the surgical abortion is not the same as miscarriage, because miscarriage is when a pregnancy ends on its own before the 20th week of pregnancy. The complications of the surgical abortion are hemorrhage, infection, injury to the uterus, and injury to the cervix. So the complications occur in around 3% of the surgical abortion cases. So the risk of complication depends on how many weeks pregnant you are. So the abortion performed in the first trimester are the safest.